Hi guys, welcome to the Healthcare channel. Today's video we will talk about 8 signs of a heart attack. Whether you've suffered one yourself or have experienced the shock of a beloved being struck by an attack, it is often devastating. Especially when it looks like a run off of the blue. And sadly, this is often the case for thousands of individuals across the United Kingdom annually. Earlier this year, one Cambridgeshire cricketer admitted he's lucky to be alive after suffering a shock attack during a village game. An attack is one of the 4 most serious medical emergencies, and that they can often be fatal or life-changing. They require immediate medical attention and may seemingly strike out of thin air, happening when blood cannot reach the guts, usually thanks to a grume. Known medically as myocardial infarctions, where myo means muscle, cardinal refers to the guts, and infarction refers to the death of cell tissue thanks to a scarcity of blood supply. An attack is when the guts muscle is broken because it doesn't have enough oxygen to function. Thankfully, your body will display 8 warning signs a minimum of a month before an attack. A number of these signs are quite common symptoms of other conditions, so don't be concerned if you've got just one, although all are worth checking. And if you've noticed a couple of them recently, it's definitely worth consulting your GP or calls 911 for an emergency. Remember, if you're suffering a medical emergency, always dial 911 immediately. Here are the 8 warning signs you create have an attack within the next month, reports our sister site Plymouth Live. 8 warning signs before an attack. 1. Fatigue. Fatigue affects 70% of girls, and if it's not something you normally suffer from, it is often one among the most symptoms that indicates an impending attack. Whilst men have reported this symptom, it's presumably to affect women, consistent with Brightside. Fatigue is often described as extreme tiredness, lack of energy and motivation, both physically and mentally, and it increases by the top of the day. It can make simple tasks like making a bed or showering exhausting. 2. Abdominal pain. Abdominal pain is diagnosed in 50% of cases of an attack. Empty or full stomach nausea, feeling bloated or having indigestion are the 4 most common symptoms and are likely to occur in both men and ladies. Abdominal pains before an attack have an episodic nature, easing then returning for brief periods of your time. Physical tension might worsen indigestion pains. 3. Insomnia. Insomnia affects 50% of girls and may also include a high level of hysteria or absent-mindedness. Symptoms include difficulty initiating sleep, difficulty maintaining sleep, and early morning awakening. 4. Shortness of breath. This symptom is diagnosed in 40% of cases and may be a strong feeling of being unable to draw a deep breath. It often occurs among both men and ladies for up to 6 months before having an attack. It's usually a wake-up call of a medical condition. 5. Hair loss. Hair loss as a symbol of a heart problem affects men over 50. It is often considered a clear indicator of heart condition, and baldness also can be related to an increased level of the hormone cortisol. 6. Irregular heartbeat. This symptom occurs with no influence of external factors. Skipped beats or arrhythmias are often amid scare and anxiety, especially among women. It appears unexpectedly and divulges itself differently: arrhythmia, irregular heartbeat, or tachycardia, increased heart rate. Physical exercises might give an additional stimulus to the rise of pulse, especially in cases with atherosclerosis disease. Some people report that the irregular heartbeat lasts for 1 to 2 minutes. If it doesn't fade, you'll feel dizziness or extreme fatigue. If you're suffering this symptom, speak to a GP immediately or call 911. 7. Excessive sweating. Unusual or excessive sweating is an early wake-up call of an attack. It might occur at any time of the day or night. This symptom affects women more often and is typically confused with the recent flashes or night sweats typical of menopause. It is described as flu-like symptoms, clammy skin, or sweatiness occurring no matter air temperature or workout. Sweating seems to be more excessive at night, the bedsheets could be damp by morning. 8. Chest pain. Men and ladies experience chest pains in several intensities and forms. In men, this symptom refers to the 4 most important early signs of an impending attack that ought to not be ignored. On the opposite hand, it affects only 30% of girls. Chest pain can expand to uncomfortable sensations in one or both arms, more often the left one, the mandible, neck, shoulders, or stomach. It may have a permanent or temporary character. If you're suffering this symptom, speak to your GP immediately or call 911 for advice. If you think that you, or someone you're with, is affected by an attack, after dialing 999 it's going to help to chew then swallow a tablet of aspirin, as long because the person having the suspected attack isn't allergic to the tablet. The aspirin helps to thin the blood and reduce the danger of an attack. Preventing an attack. There are 5 main steps you'll fancy reduce your risk of getting an attack or having another heart attack. 1. Smokers should quit smoking. 2. Reduce if you're overweight or obese. 3. Take regular exercise. Adults should do a minimum of 150 minutes, 2 hours and 30 minutes, of moderate intensity aerobic activity hebdomadaily unless advised otherwise by the doctor responsible for your care. 4. Eat a low-fat, high-fiber diet, including whole grains and many fresh fruit and vegetables, at least 5 portions a day. 5. Moderate your alcohol consumption. Please check the next video for full information about 9 signs of alcoholism. Please don't forget to subscribe to our channel for more recommendations on health, relationship, lifestyle and other helpful information to form life easier.